Did you know that retiree coverage doesn't work the same way as active employer coverage once you're eligible for Medicare? One of the biggest mistakes I see is people assuming they can delay Medicare because they have retiree benefits from a former employer. Unfortunately, that's not always true. Here's the difference. If you're still actively working and covered under an employer group health plan, employer size matters. Generally, if the employer has 20 or more employees, the employer plan pays first and Medicare pays second. If the employer has fewer than 20 employees, Medicare usually pays first. But retiree coverage is different. Once you're no longer actively employed and you're covered under a retiree health plan, Medicare is generally expected to pay first, regardless of how large the employer was. The retiree plan typically becomes secondary. That means if you don't enroll in Medicare Part B when you're first eligible because you assume your retiree coverage is enough, you could end up with gaps in coverage and potentially face late enrollment penalties. Some retiree plans require you to enroll in both Medicare Part A and Part B to keep your retiree benefits. Others may include prescription drug coverage that works alongside Medicare. Every retiree plan is different, which is why it's so important to understand exactly how your benefits coordinate with Medicare before making any decisions. The bottom line is this: never assume retiree coverage allows you to delay Medicare the same way active employer coverage sometimes does. Before you turn 65 or retire, contact your benefits administrator and ask whether Medicare will be primary or secondary, whether enrollment in Part B is required, and how your prescription coverage works. A few questions now can save you from expensive surprises later.